on YouTube. So we ended the last live just talking about, well, tachyphylaxis is what it comes down to. And the question is, what is tachyphylaxis and what does it have to do with mental health conditions? Somebody actually asked, what does anesthesia have to do with mental health? And guys, I want it to be really, really clear just how powerful the mind-body connection is and what your mental health has to do with your body and how that is like a book that kind of opens up under anesthesia. Not just today, but every day I have patients that come in with undertreated or untreated mental health conditions. And they might know about it, they might not know about it. And it comes up when, surprisingly, they can't even talk anymore. Because remember, when you go under anesthesia, you have things like this. This is one type of breathing tube. This one's called an LMA. The name doesn't matter, but this is in your mouth, right? And you can't communicate with us. You can't tell us about what your struggles are. But your body is telling us loads, even without you having to verbally tell us. It comes from the monitors that we attach you to. It comes from how you interact with the anesthesia agents, what your heart and lungs do in response. Heidi, hey, so good to see you. I will check out the Discord. Remember, for anyone who's on here, the Discord has so many comments. I'm trying really hard to keep up with them, but your support means a lot. So do keep asking on there. We have a great community growing of people answering and asking questions, and I also post all my articles whenever I'm done writing them on there. So I hope you all are learning stuff. Anna, thank you for the kind comments. Can I talk about imposter syndrome? Mario, I'd be happy to. How can I control my anxiety? All right, well, guys, let's get started. So many good questions here. And I just wanted to be very clear for people that came on late how your body keeps score. You know, when I was a medical student back at Stanford, and I'll never forget the first time I heard one of our attendings. She was actually an obstetrician. See, she said, Anthony, the body keeps score. And I'm thinking to myself, what do you mean? My thoughts don't have to do with anything with my body. Come on, man. I'm like, doctor, what are you talking about? Well, little did I know as a little, as a silly medical student or whatever, I didn't know how powerful your thoughts are in impacting your body. Partly from inflammatory load that your thoughts impart on your body. Partly from catecholamine and adrenergic excess that your thoughts impart on your body. So the first question I saw in here was, how do you control things like panic attacks and anxiety with your mind? Well, let's do it right now because I have one of these life support monitors here. I'm going to put the breathing tube down for a minute, but let's see. If you just want one example of how with your consciousness you can control your nervous system, just check it out. Super, super easy example. So I connected myself to the pulse oximeter. So you can see my pulse on here. Every time this sawtooth thing goes up, that's my heart beating, right? This is controlled by your autonomic nervous system, by your sinoatrial node in your heart, right? These are all nerves. You can be asleep, you don't have to think about it. Your heart is going to keep beating unless you have some heart pathology like a heart block or something, right? So I don't have any of those. Fortunately, my heart is ticking away here. But I can change that with my breathing if I focus on my breathing, if I'm in tune with my breathing. Heart rate variability comes in part from this very concept, right? So you can listen here with these monitors. If I bring the volume up here, it's what we connect our patients to when they're unconscious under anesthesia. I connect myself to it. You can hear my heart. Now listen closely as I breathe. Can you hear the beating change and how often it's coming? It's like, if I inhale, you're going to hear the heart rate go up, right? And then if I exhale slowly, you'll hear the heart rate go down. It's a little bit of artifact because I'm moving my hand around as I'm talking to you, but if you guys can see the sawtooth, you can not only hear, but you can see the sawtooth pattern changing there. This is just one example of the ways that you can control your nerves. Now, when people are asking me about mental health, well, you can certainly impact not only the nerves that go to your heart through the vagus nerve, but remember that the vagus nerve also goes back. There's some bidirectionality in the communication between your brain and your heart back to your brain. So there's an incredible amount that under anesthesia comes out because we're manipulating your heart and your kidneys and your lungs through all the medications that we give you when you're unconscious, right? Right? And anyways, that's that window we were talking about. So not only do things come out when you're asleep, your history, whether you're taking medications or self-medicating with substances or not, those things come out when you're asleep under anesthesia because those medications that you take regularly impact your brain. Your brain might get tolerance to it, what we call tachyphylaxis. And when we give you these medications, your brain is now responding differently to them. Does that make sense? Right? Now, tachyphylaxis is a problem because we see it all the time in the operating room because the medications that we give, your body is going to try to push back at because your body doesn't like being manipulated by external medications, at least not for very long. Classic example, when you take a proton pump inhibitor, Prilosec or pantoprazole, Protonix, whatever, that medication forces your stomach to make less acid, okay? So your body makes less acid, but your brain is like, I should be making the normal amount of acid that my body usually makes. So the second you stop taking your omeprazole, your stomach acid goes up. It's called hypergastrinemia because the hormone gastrin that underlies this will shoot up because you're constantly telling your body to not make acid, but your body wants to do what it usually does. So that's one example with stomach acid. Maybe you've experienced it before. But the same thing can happen for patients who take antidepressants like SSRIs. You keep telling your body to make more serotonin here or to degrade it less so that there's higher concentrations. If you stop taking that medication, you may have a bounce back effect. This is in addition to, sorry, I'm looking at the Discord here. All right. Okay. Interesting. Sorry, I just have, the Discord is kind of blowing up here. Thank you for all your comments on the Discord, everyone. So anyways, we were talking about how that's for a rebound effect. Tachyphylaxis is when the same medication that we give has less effect than it previously did. We see it for opioids, certainly. We see it for SSRIs. We see it for beta blockers, potentially. I mean, for blood pressure medications, I don't have it in here today, but ephedrine is a very classic one in the operating room. We give you too much ephedrine, your body will just stop reacting to it the way that we want it to react. So we can't use these things as long-term medications, certainly not in the operating room. And at home, you want to be mindful of how little or how much of these medications you use, because the goal is to hopefully let your body be in its own homeostasis where it can regulate its own hormones on its own. Now, many pathological states and diseases won't let you do that, but the goal is for your body to naturally be able to regulate as much of this on its own with the right mindset, nutrition, obviously, mental health, social interactions with others, sleep, the list goes on. And these are all lifestyle modifiable things. Cool. Okay, so I am falling behind on questions here. All right. Yes, people are asking about a pulse oximeter reading. Yeah, your oxygen saturation should be 95% or above, just to be clear. Charlene, is this biofeedback? Yes, it is. Fran, what are the colors for? These colors are completely arbitrary on here. Blue represents the the plethysmograph from the pulse oximeter. The green is what the EKG is on. I haven't connected the EKG to myself because it hurts to take those stickers off, and I don't do them for every live session. Okay, people are taking PPIs, I see. Jay, Rona, yeah. Well, Jenny's asking, should I stop with serotonin in the form of citalopram? Well, no. I'm never saying to stop your medications. Please don't interpret what I'm saying as medical advice, but rather to have an informed discussion with your prescribing physician about what are ways that we can try to live as naturally as possible to let our bodies not have to fight against the medications that we give, if possible. All right. Wanda is having surgery tomorrow. Wanda, I wish you the best. I hope everyone here sends you positive vibes for your surgery tomorrow. Best of luck. I'm seeing a lot of people saying they take PPIs. Well, that is certainly a... well, I hope you guys appreciate why I have this concern and why I raise this with patients. Is muscle atrophy in the elderly reversible? Sometimes yes. It does depend on physical activity, diet, any neurologic diseases, etc. Very good question. Is Versed an SSRI? No. Versed, which is also this guy here, is very much not an SSRI. This is a benzodiazepine, which can also have a tachyphylaxis effect, as can opioids. There can also be rebound effects, like we said earlier, from these medications. So you take your Valium for anxiety, well, when it wears off, in some patients, not all, the anxiety can come back worse. All the more reason to dig into what the root cause of anxiety is. And that's why, so the video I put up today, I hope you guys check it out. The video goes into how does your body open up like a book under anesthesia, and how is it a powerful window of opportunity to be able to address the mental health conditions that may have never been addressed before, and help empower patients when they come into the room. I'm going to move the camera here for a second, just so you can appreciate. This is an operating room. This is an operating room table. It's empty right now, right? But you can imagine that when you come in here, things can be like terrifying and really stressful and scary, right? But it's also this rare opportunity to potentially heal yourself by cognitively restructuring how you interact with the world around you and how you interact with the thoughts that come up in your mind from the past experiences that have led to that cognitive structure that you have with the world around you, and most importantly, with yourself. So, yes, if you guys are learning stuff, by the way, please hit the like button and subscribe, and check out medicalsecretsmd.com. I have all sorts of articles that I write for you all. I hope you all are learning this stuff, are learning and thinking of ways to apply this to your own health. Shannon's asking, how can a patient help themselves the most under anesthesia? Shannon, check out the video I published today. It takes 3 things to have a healing experience, and during surgery you can have all 3 of them. The wake-up call, the trust in your guide, and the catalyst for change. All 3 of them are there in surgery, so please check that out. Wanda is having robotic surgery. Wanda, I wish you the best. Okay, Mario, back to imposter syndrome with healthcare providers. Gosh, I have personally never had an imposter syndrome experience. I'm not an expert on it. I'm going to be very, very clear. However, cognitive rigidity does play a role in some aspects of imposter syndrome. The very notion of what is normal or not normal in this scenario, in the example that you're dealing with these feelings in, you got to ask yourself, why do we feel a certain way? Some of this is going to be societal rigidity, absolutely. But for better or worse, when I'm with a patient one-on-one, I cannot change societal norms. I can't change the way that they might see themselves depicted on TV. For example, a woman or a female physician, right? Classic. I can't change how people are going to interpret a female physician, but maybe I can work with that individual, or they, for themselves, can better figure out why they have those thoughts and why they have that interaction with their thoughts, why they interpret certain thoughts in a cognitive loop that leads to the symptoms and the manifestations of imposter syndrome. I can't change the world, but we can change ourselves and how we interact with that world. I don't want to sound like an escapist, but at the end of the day, I have my responsibility to the patient. I can't, not to the world. And no, I don't want to sound like I'm not shying away from a challenge, but I really want the best for the patient, and we sometimes need to restructure we have to restructure our view of ourselves inside a toxic world, because inevitably we can't change. There's going to be wars, there's going to be political strife, there's going to be all sorts of negativity around us. It's best not to fight the waves, but to learn how to ride them. Same thing under anesthesia or during surgery in this operating room, like where I am today. How important is diet versus exercise to impact health? Samir, they're both very important. Diet probably trumps in weight loss and cardiometabolic health, et cetera, but they're both very important. What surgeries do we do today? Shoulder and knees, lots of orthopedic surgeries. What percentage of my patients have surgery nerves? Shannon, probably 75%, if not more. Did you know that about 25% of patients will cancel their surgeries, their elective surgeries, if they, will cancel because they're too fearful or afraid of the anesthesia alone. So that's crazy. You're not alone if you've ever had surgery nerves or been afraid of anesthesia or surgery. Why is the heart rate on the middle finger? Fran, because I put it there originally, I can put it on the ring finger. How about that? No problem, I promise. If your blood pressure is up, can you still have surgery? Wanda, up to an extent. Depends on many factors. Has being an anesthesiologist helped me understand my own anxieties? Jay, absolutely it has. And Jay, I'm sorry to see that you've canceled many times. If you're comfortable sharing, Jay, I would like to know, only if you're comfortable, why did you cancel those times? I will share, though, just because you asked, how anesthesiology has helped me figure out my own anxieties. And as you probably know, anxiety comes from a mismatch in what we want to do and what we think we can do. So if you imagine what you want to do and what you think you can do, if those are aligned, you don't have anxiety. Anxiety comes up, rears its ugly head, if you will, when there's a divergence between what you want to do and what you think you can do. Many other things can cause anxiety as well, but this is the one that I've noticed myself when I'm taking care of patients in the emergency settings and the operating room in particular. It does help me better be in tune with myself. Not to mention me coming on here and educating you guys, I learn a lot about the underlying reasons that patients have anxiety. And yeah, we all are humans and we all can have those same reasons for ourselves as well. So I hope that answers your question. I don't mean to be vague about it, but if you want to know, I've never myself had anesthesia before, if that was your question. Okay, Fran, is a heart rate of 150 bad? Fran, it depends on what you're doing. If you're running or you're exercising, 150 might be age appropriate for you. If you're sitting at rest, there's likely something wrong. But good question. Okay, Jay, I think we're going to end here with your question because you've had, actually no, Rona asked a good question too. Let me answer Rona's first. And guys, just remember, if you're learning something, do hit the like button and subscribe. Your support helps me do this more often. And do check out the video that I published today. I think that you guys will find it educational and will learn something from it. Rona's asking, can we request a male or female doctor if they've had a bad experience with a particular doctor? Rona, you can always request, absolutely. Do feel empowered to do so. And Jay is canceled because of severe PTSD. Jay, you're not alone. And PTSD, we'll end with this question just because it's one of the most fascinating parts of the human mind that we don't understand. One of the treatments for PTSD from surgery is to go to sleep with headphones in that are giving positive affirmations while you're asleep. Why do positive affirmations while you're presumably unconscious? What does it have to do with anything with PTSD, right? Probably has to do with the fact that your brain is still processing things. Then that the auditory cortex is the most resistant to anesthesia. So all these medications that we give, the auditory processing parts of the brain are most resistant. So they are more likely to be online, even when the rest of the brain and body is off. And positive affirmations, which is a form of clinical hypnosis, is incredibly powerful even when you're not there to be conscious about it. Opens up a huge can of worms. The study from, I believe, 2020 in Germany, multi-center RCT, showed consistently better outcomes in terms of shorter length of stay, etc., from positive affirmations. So anyways, patients with PTSD, we give them positive affirmations to help, because we've noticed that patients with PTSD respond very well, even when they're asleep, to having that recording play in the background. We don't quite know how the brain does this, but it does do it. So if you have ever had that before, do discuss that with your anesthesiologist. Okay. Jay, I hope you all learned something. Fran, hey, good seeing you on here. Bye-bye. Can this also cure phobias? Charlene, yes, it can. And that's actually where the role of beta blockade and adrenergic blockade comes in. There's a tremendous amount that you can do for phobias. Oh my gosh, we'll have to talk about it a different day, but I don't have any beta blocker in here, but yeah, the lipophilic beta blockers that cross the blood-brain barrier like propranolol do have a role in breaking phobias. Once again, the best kept secrets in medicine. I hope you all learned something. We'll talk about it later on. I'll keep up with you guys on Discord. So remember, you can just go to medicalsecretsmd.com. Check that out there. Remember that you have more power over your health than you've probably ever been told. This recording will go on, so if you missed something, you can check it out there. And I hope you all We'll continue to follow, and you can keep sharing more secrets about your body to live in ways that are healthier than you probably ever thought you could. Take care, everyone. Bye.